There are millions of Americans right now who think they're doing everything right. They're still working past 65. They have health insurance through their employer. They're covered. They're safe. They are not. Because buried inside the Medicare rulebook is a trap so specific, so detailed, that even HR professionals get it wrong. And when you fall into it, the penalty doesn't just hit you once. It follows you every single month for the rest of your life. Today we're going to show you exactly who is at risk, exactly what the trap is, and exactly how to protect yourself before it's too late. Stay with us, because in the next 10 minutes we're going to cover something your employer has almost certainly never told you. And the worst part, they're not legally required to. Welcome back to Medicare Exposed. Every week we dig into the deadlines, the traps, and the fine print that the Medicare industry hopes you never find. If this is your first time here, hit subscribe right now. Because if you're anywhere near 65, what we cover on this channel could save you thousands of dollars. Let's get into it. Here's the situation most people find themselves in. They turn 65. They're still working at a job they love, or a job they need. They have employer health insurance that covers them, and maybe their spouse. And someone, maybe a friend, maybe a family member, mentions Medicare. And they think to themselves, I'm covered through work. I don't need Medicare yet. I'll deal with it when I retire. That logic sounds completely reasonable. And in some cases, it is completely reasonable. But in other cases, that decision is quietly setting a financial trap that won't detonate until years later. Here's the thing, nobody tells you. Whether you can safely delay Medicare entirely depends on one specific factor. Just one. How many employees does your employer have? That's it. 20 is the magic number. And which side of that number your employer falls on changes everything. Let's talk about the 20 or more situation first, because this is where most people are. If you work for a company with 20 or more employees and you have employer health coverage, Medicare considers your employer insurance your primary coverage. That means your employer plan pays first. Medicare would only be secondary. In this situation, you have options. You can delay enrolling in Medicare Part B without penalty. Medicare gives you what's called a special enrollment period, an 8-month window that opens the moment your employment or employer coverage ends. When you retire, you enroll then. No penalty, no problem. But here is where people get burned even in this situation. They retire. They think, okay, I have 8 months to enroll, so they go on COBRA to bridge the gap, and they wait. Big mistake. COBRA is not employer coverage in Medicare's eyes. It is not qualifying coverage. The moment your active employment ends, your special enrollment period clock starts ticking. COBRA does not pause it. COBRA does not reset it. It keeps running whether you know about it or not. And if you burn through that 8-month window while you're on COBRA thinking you're protected, you've just created a permanent penalty, not a fine you pay once, a permanent increase to your Medicare premium every month for the rest of your retirement. Let that sink in for a second. You did everything you were supposed to do at your job. You retired properly. You got COBRA coverage so you weren't uninsured. And Medicare penalizes you for it, because you didn't know about a rule that nobody was required to tell you. That is exactly why this channel exists. Now let's talk about the situation that is even more dangerous. Small employers, fewer than 20 employees. If you work for a small business, a family company, a boutique firm, anything under 20 employees, the rules flip completely. And most people have absolutely no idea. When your employer has fewer than 20 employees, Medicare becomes your primary insurance at 65. Whether you want it to or not, whether you enrolled or not, your employer plan becomes secondary. What that means in practice is devastating if you don't know it. Your employer insurance starts paying as if Medicare already exists and is already paying first. So if you haven't enrolled in Medicare Part B and you go to the doctor, your employer insurance looks for Medicare to pay its share first. Medicare isn't there. So a big chunk of that bill, the chunk Medicare would have covered, gets denied. And you pay it out of pocket. Not because you did anything wrong, not because you weren't insured, but because you didn't know that the rules for small employers are completely different. And here's the kicker. Even after all of that, even after paying those denied claims out of your own pocket, you still owe the Part B late enrollment penalty, because you delayed enrolling when you should have been enrolled. Pause here for a second. Because this is the part of the video where most Medicare channels would say, okay, you know the rules now. Good luck out there. We're not going to do that. Let's talk about what you actually need to do. Right now, today. Whether you're still working or planning to retire in the next few years. Step 1. Find out exactly how many people your employer employs. Not how many are in your office. Not how many are on your team. Total employees company-wide. This number is the foundation of every Medicare decision you'll make. If you're not sure, ask HR directly. Get the number in writing if you can. Step 2. If your employer has 20 or more employees, you likely can delay Part B while you're actively working. But the moment you decide to retire, do not wait. Do not assume COBRA buys you more time. Enroll in Medicare. Part B within 8 months of your last day of work. Set a reminder on your phone the day you give notice. 8 months goes faster than you think when you're busy planning a retirement. Step 3. If your employer has fewer than 20 employees, talk to a Medicare counselor before your 65th birthday, not an insurance agent who earns a commission. A free Medicare counselor through your state health insurance assistance program, also called SHIP. These are federally funded advisors who have no financial interest in what plan you choose. They will walk you through exactly what you need to do based on your specific situation. The service is completely free, and it could save you thousands. Step 4. And this one catches people off guard. If you have a spouse on your employer plan, your Medicare decisions affect them too. When you retire and move to Medicare, your spouse may lose their employer coverage entirely depending on your plan rules. Don't make this decision in isolation. Look at the whole picture before you pull any trigger. Here's the bottom line. Your employer is not your Medicare advisor. Your HR department is not your Medicare advisor. Even your insurance company, who is absolutely your insurance company, is not your Medicare advisor. They have their own interests, their own commissions, their own products to sell. The only people in this equation whose only job is to look out for you are channels like this one. And the free SHIP counselors we just mentioned. The Medicare system was designed with complexity baked in, and that complexity costs real people real money every single year. Not because they're careless, not because they're uninformed, but because they trusted that someone would have told them if something important was at stake. Nobody told them. We're telling you. If this video helped you, or if you know someone who's working past 65 and has no idea this trap exists, share this video with them right now. This is exactly the kind of information that gets people to say, I had no idea. Nobody ever told me that. Hit subscribe and turn on notifications, because next week we're covering the decision that financial advisors call the most important retirement choice you'll ever make. And most people get it completely wrong. You don't want to miss it. We'll see you there.